So today morning we will try to look at the different balloons we use, not for angioplasty, but for balloons that we will use for predominantly the management of aneurysms and also for some other embolization procedures. Okay, so the first thing when you see a balloon is have a look at the hub. So you can see here I have connected a Y connector, but this is got a hub which has got only one single lumen. You can see that, right? Compare this with, for example, this. Now this has got two lumens. Have you get it? Okay. Now, why is it important? Because in case of a single lumen balloon, both the wire and the contrast for inflation of the balloon will go through a single lumen. The advantage is that it is more trackable because the profile will be a little lower. Disadvantage is that since the lumen takes both contrast as well as the wire, if the wire comes back, then blood can flow back into the system and enter into the balloon, and then it becomes a very, very dangerous device to use because it will not deflate after inflation, nor will you see the inflation taking place. You can have a vessel rupture. So as I describe this balloon, I will tell that in greater detail. So let's start from the hub. So like I said, this hub has just one lumen and you cannot mismatch the wire. Now, if you're using basically the single lumen wires, single lumen balloons come from three companies. EV3, which was finally purchased by Medtronic, makes the Hyperglide and the Hyperform, two balloons. I'll talk about the difference a little later. That takes a wire which is called the Expedion wire. It's a 1-0 wire. So it is only with this wire that the distal end of the balloon will function like a occlusive valve. Okay. So when this exits out, what will happen is contrast cannot leak any further and the balloon will start inflating. Okay, we'll talk that in a little more detail. In my hand, I have got a balloon which is called the transform. Transform is made by Stryker. Now, transform recommends that you use a 1-4 wire. So if you see the tip of this wire is 1-2, but as you go down, it will become 1-4 and seal will come place only at 1-4. And lastly, we have a balloon which is called the Eclipse and the Copernic. Both these balloons are made by Balt. These are also single lumen, and the advantage here is that they come in different lengths and size, again, which I'll talk, but works on the same principle that you have to use an appropriate wire, and which is the hybrid wire that comes along with the pack. Okay, so it's safer to use the wires they give, but that also takes a 1-4 wire. Now let's have a look at this balloon. So we pull the wire out and we inject contrast. You can have a look at it. Can you see it coming out? Okay. So you see that it leaks freely through the same lumen as long as the wire is not inside it. Advantage is if you want to deflate the balloon rapidly, pull it back and it will immediately deflate. The second advantage, it's very easy to take out air from these balloons. All you have to do is just push the saline or contrast and it will come out. Now when you prepare the balloon, remember one thing, you first put called diluted contrast. In this you can go up to 70%, flush it, connect a Y connector in the back. Once you're connected, you must ensure that you have got a two-way stopcock on the other side to keep the balloon inflated. And you again flush with the Y connector, take the wire inside and again flush halfway through to ensure there is no air. And you can see that the balloon doesn't inflate. Now, as we take the balloon out, When you have just the tip of the balloon out, let me just wipe this out, you will see it still leaks. Although you can see the balloon inflating, you can also see fluid leaking out. Can you get that? That is because the wire is still not optimal and the balloon is inflating. Now let me try it by pushing more of the balloon. We deflated it. Now we push a reasonable length out. Now we know that the 1,4 component has come. Now it won't leak at all. Okay. So can you see that? There is no leak. Now this is important to understand this because you put the balloon and you'll find it continuously leaks. You cannot use it for a remodeling procedure. Okay. So have you got this principle? That you need a 1,4 lumen to occlude the tip. A 1,2 will not. Both Traxxas as well as Synchro, the distal tip is 1,2, and because it's 1,2, it will not occlude, and it's only you after about 5 to 6 centimeters exit out, it will occlude. So if you deflate it, you can deflate it. Now, what is the big advantage in a country like India? We should not be reusing balloons, but if you want to reuse balloon, the only balloons that can be reused are the single lumen balloons because it's easy to vent the air out. Can you get that? See. So this is a transform. Now, all balloons are made to be very, very soft. They are not meant for angioplasty of ICAD. You can never use it for doing angioplasty of ICAD, but you can use it for angioplasty of intracranial spasm because there you only want to stretch the smooth muscle. You do not want to injure the vessel. So one of the indications of this balloon is the angioplasty of intracranial spasm. Okay. Now, like I said, if you want to do an angioplasty of an intracranial spasm, you have to use longer balloons. And all companies make these balloons into 4 into 20. Okay. 4 into 20. The only balloon that comes in 6 is the Copernic. Now, Copernic is made by Balt, very similar. So remember, if you want to use it in a larger vessel, go for Copernic. So what is the next indication? The next indication of this balloon is doing a test occlusion. It's very simple. You take it in the petrous segment, which is the safest segment, inflate it, occlude it, right? Now remember, it is important that the wire is well beyond it. Otherwise, your test occlusion will look like positive or negative. I don't know how you use it. Basically, the patient will not have neurological deficits because the balloon is deflating. So you have to have it distal, but you can use this balloon. Of course, you can use a double lumen balloon, which I'll talk a little later too. But like I said, if you're reusing a balloon, which like I said is not advisable, but if you plan to use it, take a single lumen balloon. The third place where we use balloons is the most common place, and that is for the balloon remodeling technique when we work with aneurysms. So why do we have all these lengths that I talked about? And why should we understand the property of the balloon when we are working with an aneurysm? Now, balloons come as hypercompliant, compliant, and semi-compliant. Semi-compliant balloons are used for angioplasty. Hypercompliant balloons are used for remodeling in intracranial vessels at a branch point. So typically, the Scepter XC, which is hypercompliant, the Hyperform, which is hypercompliant, are and the shorter forms of the Copernic, which is again hypercompliant, and the shorter lengths, that is less than 10 mm lengths of the transform hypercompliant, are used as branching points. So what is a branching point? Typically, it would be the branching of the basilar top, the branching of A1 at the ACOM segment, and the branching of the middle cerebral artery when it bifurcates. So in all these locations, the ideal balloon is going to be the hyperform or a transient which is less than 10 mm or the scepter XC. Looks very similar except that the length will be shorter, but the balloon is actually softer, so technically it can mold into the side branch and protect it. Having said that, it's not that you can get it like we see in the diagram, but it's definitely more compliant than the compliant balloons that are used in the sidewall aneurysm, like the internal carotid artery. Now, this is a transform balloon, which is 15 millimeters long. So this is ideally suitable for a sidewall aneurysm. For example, you are working in the wide neck PCOM, wide neck paraclinoid, then you would use this. It is safe and it's the best way to treat an aneurysm in the ruptured phase. And what the balloon does is it will cover the neck so that when you have a microcatheter by the side, it will prevent the coils from prolapsing out. Now, the second balloon which I wanted to show you is a dual lumen balloon. I hope you got an idea. You can go 70% contrast easily. I know there are people who have even used 100% contrast. So setting it up is like this. Like I said, you'll have to have a white connector, no infusion to run. On the side, you'll have 70% contrast. You'll flush the whole system. After that, you will have the wire. And as you take the wire, you can flush again. And so this is because it's dry. So like I said, you can flush even at the last minute, allows you to push the balloon through it and enables you to prepare the balloon and use it. So remember, once the balloon comes back, blood can also flow back into this lumen and that can go into the balloon, which can be disastrous. So if you want to change the shape of the wire inside the body, it is tricky. You can do it, you have to continuously keep flushing forward. As you keep flushing forward in this form, you have to take out the wire and put a fresh wire with a new or a wire with another shape. But it's much better than this to take out the whole system and give a fresh shape and take it back. Because of this, all of us prefer to use a dual lumen balloon when we are working at branch points. Because if you're going to work on a straight segment, the shape of the wire doesn't matter too much. But if you're going to work in an MCA bifurcation, you will have to sometimes reshape the wire, and it's much better in this circumstance to use a double lumen catheter like this. Now the advantage here is the lumen of the wire and the lumen of the contrast that goes into the balloon is separate. But the problem, like I said, it's fantastic. It is a perfect device to use. But the only problem is what? The only problem, like I said, is you can never ever vent the air out of a reused balloon. It's impossible. And why is that impossible? Because the tip actually is not sealed when you get the balloon. But once you have vented the air out, so how do you vent the air out in this? Technically, you would be injecting, and as you inject, you will do the venting inside saline. So technically, I use contrast for both. So as you inject, a small jet of air will come out, and once the air leak completely stops, then when you inflate it, the balloon will inflate. Okay, so this one is a reused balloon and it is not working because it's blocked. Now these are the problems that will happen with a reused double lumen balloon because the lumens are much more fine and it's not supposed to be reused, honestly speaking. So how do you prepare it? Like I said, you vent it. After that, the contrast fills. Then when you aspirate plat the fluid, don't forget this step. Aspirate it always inside the contrast column. Otherwise, air will come back again and it may never come out and the balloon becomes useless. So once you aspirated it completely, there is a sleeve that comes with it. Put the sleeve on and heat the tip at 100 degrees, either with a steamer or with a hot blower. Now, this is what will seal the valve completely. If you do not sleeve the valve, what happens when you're injecting into the balloon and you keep it across a segment, it will slowly deflate. So you'll find that the balloon keeps on deflating. The only way out is after you vented the air. Remember, after you vented the air. If you do it before venting, air can never leak out and it will not work. So in our practice, for all bifurcation points, we use a balloon like the Scepter XC, but I believe Copernic also has got a double lumen. You can even use that. They are shorter balloons. Scepter will come in the length of 7 mm and the diameter will be 6. Now, why do they give a diameter of 6? So that it can prolapse onto the opposite vessel. The commonest location, like I said, is MCA bifurcation, basilar top, and also in the bifurcation of the A1. But remember, the balloon lengths are very short. So if you try to use it on a sidewall aneurysm, for example, the PCOM or the paraclinoid location or the ophthalmic segment, the balloon will not be stable. As you start inflating, the balloon will start moving up. So there is a disadvantage. It will be a big mess. So use longer lengths, either 15 or 20 mm balloons, right? Now remember, this balloon, since it's got two lumens, has got some unique advantages. One is you can pull out the wire, change the shape as many times as you want. It's not a big issue at all. Also, if you feel like it, you can take out the wire once you've gone to the target position and let infusion run, making the system less thrombogenic. And thirdly, you can also use it to inject onyx or squid or minox, because this whole system is DMSA compatible. So you can, for example, you're trying to treat an AVM or you're treating an AV fistula, you inflate the balloon, arrest forward flow, and then inject a liquid embolic agent like onyx through this, and you can do it very, very fast, right? So that's another use of it, which is the third use of a balloon, and that is to use it like a wedge device and then inject onyx through it. Be careful because you cannot rupture the vessel, so it has to be very gently done. Once you've arrested the flow, then you can start injecting, and like I said, it can be pretty fast and pretty easy. The last use of the balloon is for allowing us to cannulate vessels. So, for example, you're working on a very difficult angle of the ICA bifurcation and you want to take a catheter in the opposite side. And the loop is maybe very acute, so inflate the balloon at the proximal MCA so that the loop will, touch this and go back. But more often than that, we will invariably need a balloon when you're working with an AVM which has supply from the perforators that arise from the M1 segment. Those are tight curves. They are in the opposite direction of the MCA. So to get that loop, you will have to inflate the balloon. And then once you've inflated the balloon, you will allow this to touch and go back in this direction. Okay. So that is about the typical classical uses of balloon. So somebody will ask this question, should I use a balloon for all aneurysms or only for the wide neck aneurysms? So let's talk about that now. Whatever aneurysm you use, if it is small, try to keep a balloon across so that if there is a rupture, this will work like a temporary clip. Okay, what about the balloon you're going to use? It will work like a temporary clip. And the advantage of the temporary clip is you can complete your coiling without a bleeding. And all of us have had ruptures on table, but hardly any patient has ever died after balloons have come. So it's good for irregular aneurysms, small aneurysms, even if the neck is narrow, right? So if you can afford it, try to keep it in all aneurysms because it works well. Secondly, if the microcatheter tip is unstable, inflating the balloon even below the aneurysm fixes the micro so it doesn't move too much and you can still complete the coiling, right? So those are the key indication: balloon remodeling, angioplasty of a spasm, test occlusions, then of course balloon remodeling, which is the commonest cause, to save the patient's life in a rupture, and to fix a microcatheter if it is unstable, and lastly to cannulate vessels which come out from different angles, right? So we showed you this. Now, so this is another double lumen balloon. By looking at the length, if you have a company marked over here, it becomes very easy. So this probably is the company.
Scepter C.
Pardon?
Scepter C.
Oh, this is a Scepter C. Okay. So this is the Scepter C. You can see that the length, I'm not sure whether the balloon is working or not, because like I said, the problem is reusing these balloons are difficult and we don't want to open any. Okay, so this one is working. Can you see that? It is much longer. Can you see that? So this is a sidewall uh, balloon for treating a sidewall aneurysm, but can you see the air doesn't come out? See that? There's no way you can get this air out. I might aspirate it any number of times, but finally this air will never leak out because you will have some amount of air coming out, but you can, because venting is only possible if you have a distal opening. So there is an advantage, but like I said, nowhere other than India will anybody be talking about even attempting to reuse a balloon. So it is technically not a disadvantage, and most people, that's why, prefer to use the double lumen. The key advantage being the wire is independent. So we actually thought we vented the air. Can you see? So now you can see a little fluid coming inside, but still there is a lot of air. Now once you're inside the brain, you will find this air occupies much more space because you never inflate it so much. So you can attempt to do this several times of aspirating and trying to get the air out. If you're lucky, it will work. But in real life, we find it hardly ever works. Okay. So again, there is air. So this is a big problem, right? But like I said, it's very simple in every other way. You have a wire by the side. It works like a micro. And all these balloons can be used for injecting another agent through it because it's easy, right? I'll just show. So I'll just show you what happens. So here it is. This is the lumen through which you put your wire, the second lumen. And as you inject, you would see the fluid comes out. You can see the fluid coming, right? So can you see it's totally independent, making it very easy. And because of that, now instead of this fluid, if you start injecting a liquid embolic agent like onyx, it's going to do the same thing, right? And that definitely is a distinct advantage. So in our lab, it's a very, very popular balloon. We use it extensively, but more than the long balloons, we tend to use the shorter ones for the bifurcation points. We can use it also, obviously, for the sidewall aneurysms, except that it's a little more costly than a single lumen balloon. That's all. Other than that, there is no disadvantage. They're all made of silicon and they are all extremely safe. And unless you hyperinflate them and you rupture the balloon. Okay. Now, there is another set of balloons. So now I've got another balloon in my hand. Like I said, it is a single lumen balloon. You can see that the wire is going through it. This is the Copernic. Now, what is the advantage of the Copernic over the hyperglide or the transform? Nothing except for one fact that it gives you a diameter which goes up to 6 mm. Okay, you can see the same phenomenon. You can see the fluid leaking out. You take out the wire, and so the wire that comes with this is they will give you the hybrid wire, but technically this is a synchro wire. It's a 14 wire, again, it will work in the same principle. You can see the balloon inflating. And like I said, the advantage of all the single lumen balloons is there'll never be air inside. It's extremely easy to use it. Now, Copernic has the distinct advantage that you can get Copernic in lengths of both 8 and 10 centimeters, of diameters of 8 and 10, which is useful if you want to use this for occluding a venous sinus when you are injecting a liquid embolic. For example, you have got a patient who's got a draining vein, say the vein of Labe is coming into uh, the the segment which has got a fistula, then you can actually keep this balloon inflated at 10 mm across that vein and then do the treatment so that it continues to be patent at the end of it. Okay, I hope you understand that. I know there are some friends of mine who also use this in location like the vertebral artery. For example, you've got a dural AV fistula coming from the transverse sinus. There is supply coming from the vertebrobasilar segment also. And as you inject, you may sometimes retrogradely fill up the segment. So using these long balloons has an advantage. When you come close to the segment, you can inflate the balloon so that you can see the basilar artery because of the balloon in it, and second, you can prevent reflux into the main artery. Okay, so this is the Copernic, like I said, and the Copernic is advantages. It has a larger diameter. Copernic is again a compliant balloon, not a hyper compliant balloon. If you want to use a hyper compliant balloon from BALT, it is the Eclipse, and Eclipse behaves exactly like the hyperfoam, and has not much of a difference. Okay, so that's a little bit about Ball's balloon. Like I said, its niche area is large vessels. So let's have a look at the way balloons are packaged and comes. This is a striker balloon transform. You can see at the distal end itself, it's got only one hub, so it's a single lumen. It is basically a compliant balloon, technically not hyper compliant. Having said that, once the length is short, for example, this is 415, it will change its character. So 415, so it's a sidewall balloon for sidewall aneurysms and can be also used for intracranial angioplasty. And technically, like I said, it behaves exactly the same. First purge the lumen, then take the wire, and they will also, this works best with the transient wire, but you can also use it with a synchro. But remember, like I said, you have to take it distally. Okay, now I'll show you another balloon by the cover. Now this is Copernic, right? And the Copernic balloon, as you can see, it will be written over here, Copernic 15, which basically means the length of the balloon is 15. It's got a diameter of 5 mm. Basically, it's from 4 to 6 mm if you see the literature. It's a very soft, supple balloon. And again, it's a single lumen balloon and again used for sidewall aneurysms. But the diameter, like you know, is more than that you get with other balloons. Another compliant balloon is the Scepter C. Okay, look at it again. B is going to be the length, which is 15 mm, and then you've got a diameter which is A, which is 4 mm. And that's why I told you, other than the Copernic, we don't have a balloon which has got larger diameters. And again, this has got two ports at the hub, and you know it's double lumen, right? So once it's double lumen, you are no longer worried about the wire, because any wire which is technically useful for taking a microcatheter works with this. So you can use a Traxxas, you can use a Traxxas EX, you can use a Synchro, it's your choice. Whatever the wire, it's going to work fine because they got independent lumens, which I showed you, and it's got this measurement here. C is 5 mm. So basically C is this distance. And this distance is good because even if you take out the wire, for example, you're in the A1, A2 junction, your balloon will be in the A1, in the anterior communicating artery, but the tip will be reasonably well into the A2 segment. So that's one way that you can take out the wire and see it. Also, these markers are there. There'll be three markers, one distal marker, one across the balloon. This is very helpful when you're injecting a liquid embolic agent because it can actually tell you where the tip of the catheter is. Now, this has got the word XC written on it. What does XC mean? It's hyper compliant or it's extra compliant, and these are going to be shorter balloons. For example, this is 4 mm, 11 mm in length. Hyper compliant balloon, they show this round shape over here. It is shorter, but otherwise is very, very similar to the previous balloon. So, like I said, these are some of the balloons that you can see. When you go to the shorter length of the transform, it behaves like an hypercompliant balloon. If you go with also the eclipse, it will behave like the hypercompliant balloon. And I hope you got a general hang of balloons and how they are packaged and how they have come. And remember one more time, the most important thing, the wire can never come out inside the body. When you're doing a procedure, blood will come back. If something like that happens, pull out the whole system, flush outside, ensure that the balloon inflates and deflates before going in. And if you find there's blood inside the balloon as you inflate, you have to discard it. There's nothing more you can do. So if you're a beginner and you're starting with, try to use double lumen everywhere. It's much safer. Risk of complication is much, much lower. But if you're used to a single lumen, or if you have a situation where you need a single lumen balloon, like like for example in the ICA, like I said, and you need to use the Copernic, you can use a single lumen. So that's a general overall view about balloons, and I hope it clears most of your doubts. What are the most dreaded complication? The most dreaded complication, like I said, is a balloon that does not deflate, and that happens in a single lumen, does not happen in a double lumen, and that is because the wire has come out, and you have to be exceptionally careful about that. So that sort of covers the uh, talk on different balloons. We talked about single lumen versus double lumen. We talked about the long ones versus the short ones. We talked about the compliant versus the hyper compliant. And we understand that in the bifurcation points, it is short hyper compliant balloon that the septa C or the hyperform, or even the short length transforms and the Copernic. And the sidewall aneurysms use the compliant balloons. The important thing is length. And these are definitely the most common places where you would use a balloon. Okay, so thank you. I hope that this has kind of clarified most of your basic doubts about how to work with balloons.